Is it cool to start sharing my slides now? What? So they could be up while you do the introduction, or would you want me to wait?
I think either way is fine.
Okay. Can you see the slideshow?
Yep.
Okay, good.
All right, we will go ahead and get started. Hello, everybody. My name is Quentin Pedro Solano. I use the pronouns he, him, his, and I'm an able-bodied cisgender male. I'm a Mexican Polish American born in Detroit. I'm wearing a blue polo shirt today with the Diversity of Medicine football backdrop behind me. I'm a third-year medical student here at the University of Michigan Medical School, and I have the honor and privilege of introducing our next keynote speaker, Dr. Randy Vince Jr. Dr. Vince was born and raised in Baltimore, Maryland, and is the oldest of 4 siblings. It is in Baltimore where he developed a passion for athletics, and after graduating high school, he went on to attend Towson University, where he was a varsity letterman in football. At Towson University, he double majored in MB3, which is molecular biology, biochemistry, and bioinformatics and chemistry. He went on to attend Louisiana State University Health Science Center in Shreveport, where he earned his MD. He completed urology residency at Virginia Commonwealth University Health Systems. During his intern year, he earned the Department of Surgery Best Teaching Award. He developed a passion for urologic oncology, particularly renal cell carcinoma. This led him here to the University of Michigan for a urologic oncology fellowship. While at Michigan, his research is focused on using genomic platforms to enhance clinicians and patients' diagnostic and prognostic data. Additionally, he is aimed at using genomic panels to highlight the impact of systemic racism, not racial biology, on disparities in cancer outcomes. Outside of his impressive academic work, Dr. Vince enjoys weightlifting, traveling, spending time with loved ones. We will have a few minutes at the end of this for a Q&A, so please, I encourage you to input your questions into the Q&A chat, and I will be moderating that. And with that, Dr. Vince, please take it away.
Yeah, thank you, Quentin, for that kind introduction. Hopefully everyone can hear me well. So for those of you that I haven't met before, I'm Dr. Randy Vince Jr. I use the pronouns he, him, his. I am able-bodied and I'm cisgendered male. I'm wearing a blue blazer with a white collar shirt, and my slide background's a Michigan medicine slide backgrounds. So I want to thank everyone for the opportunity to be a keynote speaker. I must admit, it makes me laugh a little bit hearing the word keynote speaker attached to my name, because in my heart, I'm simply a kid from Baltimore trying to do the right thing. But with that, let's go ahead and get started. So when it comes down to today's conference, the overall discussion is around enacting change, the physician's role in social justice, diversity, and intersectionality. And so, for me, I like to look at things from a broad level and then kind of hone in on exactly what I mean. So at a broad level, I think we have a role in education, outreach, and mentorship. And I'll go through each one of these and explain specifically what I mean. But before I do, one thing that I'll constantly say throughout this talk is that every physician has a certain amount of social capital. And it would be wise of us to leverage that social capital, to impact change. Before I get too far off in the presentation, I want to give a caution to everyone. I talk about racism, and specifically structural racism, in pretty honest and blunt terms. And so I know this makes some people uncomfortable. I'm of the mindset that being in these uncomfortable spaces is when we can actually make the most growth. So I'm just cautioning people now. There's nothing too graphic or anything in my slides, but the reason I do this is because I think racism is arguably the oldest and most lethal form of social injustice in this country. And so, there is an overlap and intersectionality with many of, the social injustices we see as it relates to people with marginalized social identities. So some of the things I talk about are applicable to other forms of social injustice as well. So when we talk about education and non-education, the sister Lash Nolan, she gave a great talk to open up the conference today. And she was aiming to really shine a light on, educate people on exactly what's going on and the history behind what's going on. And so with this, I think it's specifically, important to uneducate ourselves. And I'll tell you exactly why. So I want to discuss a concept called the big lie. This guy, Joseph Goebbels, he was the minister of propaganda in Nazi Germany. And he said this quote: "If you tell a lie big enough and keep repeating it, people will eventually come to believe it." And I think Isabel Wilkerson in her book Caste eloquently highlighted that many of the oppressive systems we've seen throughout human history actually harbor the same elements. And one of them is the big lie. And if you need a current day example of this, look at the 2020 election. It was a lie that was repeated over and over again. And ultimately we had the violence that was perpetrated on January 6th of this year. But I want to take it back to a historical perspective. And so first I want to look at this document, the Declaration of Independence. In opening lines of the second paragraph, it said, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness." And so this is something that James Baldwin has, if you ever read any of his work, has touched on, because now what happened is you have this document that is now declaring independence from Britain, and you have a system of slavery that exists. That's the economic engine of a developing country. And so these two things are contradictory. And so now you have to reconcile this contradiction. And how did that happen? Well, racialization. That was a social concept of race that was created. And then within our country, that deemed that Black people were inferior and whites were looked at as superior, right? So now you can see how they were trying to reconcile this contradiction. Because if Black people are seen as subhuman and inferior, they don't need equal rights. They don't have inalienable rights. So that is the way that they reconciled that contradiction. And so since that time, we've seen experimentation on Black slaves. We've seen the concept of eugenics. We've seen racialized medicine. And all of these things have an impact on where we find ourselves today. So I think it's really important that we unlearn the things that we may have been taught about race, re-educate ourselves on the true foundation of this oppressive system. And part of that is combating a dominant narrative. So undoubtedly, most people on this call have heard something like this: "You can obtain anything in this country if you just work hard enough." This insinuates that our country is truly a meritocracy. And to take that a step further, it insinuates that there is equitable access to all resources in this country, such as education, the ability to build wealth, no matter what your social identity is. And even within that, there's this concept of rugged individualism. And so many of you have probably heard this. When my grandfather came here from country X, whatever country that was, he only had the clothes on his back, and through hard work, he became successful. So this frame of mind starts to make people assume that all citizens, regardless of their social identity, had equal access to resources, which just isn't true. And that's the reason why Martin Luther King said in his 1967 interview, "It's a cruel jest to say to a bootless man that he ought to lift himself by his own bootstraps." And so I want to just kind of take a second to highlight how inequitable access to resources like wealth building and education have current implications in where we find ourselves at today. So to highlight this point again, I'm going to touch on wealth building and ability to obtain higher education. So I want to start with wealth building. I think in this country, it's widely accepted that home ownership is a primary tool of wealth building for most Americans. Specifically, that wealth can be passed from generation to generation. And if you know me well enough to know, if you know me well enough, you know that I'm constantly referring back to a lot of my experiences in my hometown of Baltimore, Maryland. And so I dug up this map. And this is a map of 1937, and it shows the red line districts within Baltimore. And for those of you who are unfamiliar with the practice of redlining, this is a policy that was implemented to designate areas that were too risky to provide mortgages to. So while in the policy, it didn't say specifically that these areas had to be in Black communities, they were predominantly Black communities that were deemed too risky. So I'll zoom in really quickly just so I can highlight exactly where my family is from. And then I'm gonna zoom back out, because what I wanna do is I want you to see, look at this pattern. This is the Patapsco River, if you can see my pointer. And then I want you to look at the pattern of the red and yellow communities here. Now, these are the areas that were deemed too risky. And again, this is in 1937. And so I want to highlight how this has current day implications. So this is a map that was published in the Washington Post in 2018, which highlights home vacancies within the city of Baltimore. And so you can see that there's a similar pattern and a similar distribution when it comes to those red line areas and home vacancies. And so let's put this together really quickly. So I want to walk you through this vicious cycle. So if you have home vacancies, anyone who has a working knowledge of real estate knows there's a word called comps or comparables. And so your property value, if you're a property owner, is greatly influenced by the community around you, the properties around you. And vacant properties, the more vacant properties, the worse the property value. And so when you have a large number of home vacancies, you have decreased property value. Well, what does that cause? If you think about it in these terms, property value is how we assess what taxes should be assessed to that property. So if you have decreased property value, now you have decreased property tax revenue. And property tax revenue is a major part of the mechanism to fund schools. So then you end up with decreased school funding, and then you end up with decreased resources within schools, and then you end up with poor performing schools. And it's this vicious cycle that perpetuates itself generation after generation. Additionally, I can build on this, just quickly. If you have an area that is poor and impoverished, what makes you think a store like Whole Foods that sells produce that is pretty pricey will want to move into that community? So this is how we end up with things like food deserts as well. So this kind of just highlights the wealth building concept that I wanted to touch on. Now I want to touch on higher education, and I want to give an example. Take it back to 1944, which was after World War II, when the U.S. had passed the GI Bill. And this was aimed at allowing veterans to obtain homes and get a higher education. So we talked about, all of the things when it comes to home ownership and wealth building, but I want to focus specifically on higher education. You see, it wasn't wrote into the GI Bill that Blacks couldn't obtain tuition assistance, but many institutions of higher education were just flat out not even accepting Black people. And so when people say they're skeptics of structural racism, it's because they don't really understand how, these policies might not actually explicitly say that Black people cannot do one thing or the other, but the implementation of the policies in the real world society shows that this is, the actual impact. So this is a picture of George Wallace, the former governor of the University of Alabama, preventing integration. And so many of the institutions and within our country of higher educations simply weren't accepting Black people until the late 1960s, 1970s. And to take that a step further, there are a lot of grade schools around this country that were not integrated until the 1990s. And I, saw proof of that when I was living in Louisiana. So this is just two examples of how our country is far from the meritocracy that is presented as. And then I want to just take a second and hit on racialized medicine and past practices. So these three gentlemen, from left to right, Hugh Cummings, Talia Farrell Clark, Raymond Vanderleer, they all presided over the infamous Tuskegee experiments at one point in time. And they all learned racialized medicine. And during that medical school training, they gave scientific credence to the eugenics theory. And so there was a belief that there were biological differences between Blacks and whites. And so why does this matter nowadays? So all of those gentlemen attended the University of Virginia, and that's where this study in 2016 was published from. And many of you on this call have probably read this study. And within it, you can see here highlighted in red, these are several false notions that state biological differences between Blacks and whites that are still believed to this day. And so as I wrap up education, and I spent the most time on this because I feel like this is the most essential and imperative part of the talk. I want to say that physicians inherently have social capital, so we must unlearn things that have been incorrectly taught, educate ourselves on the true history, take steps to educate the future generation, and acknowledge our country's history and its current day implications. And if you need an example of why this is so important, look no further than this podcast that was put out by JAMA. And no physician is racist. So how can there be structural racism in healthcare? This just highlights a lack of sensitivity and a lack of education as it relates to actual true history and how these things manifest themselves in current day. So I want to move on to outreach really quickly. So to me, community outreach and community engagement is so important because even within structural racism and other forms of social injustice, health disparities are a form of social injustice all within themselves. And so community outreach and engagement can actually help improve health literacy, increase participation in clinical trials, and increase diversity within medicine. And I'll touch on each one of those specifically. So as we unpack this, I want to start by referencing a book that was published by the Institute of Medicine, Health Literacy, a Prescription to End Confusion. And within this book, they said efforts to improve quality, reduce costs, and reduce disparities cannot succeed without simultaneous improvements in health literacy. And so these don't have to be $1 million projects. All you need is a desire to impact change, and you see that the problem is there, and you go out and you do something, right? So it doesn't have to, while I'm not going to lie, additional resources are definitely needed when it comes to this work, but community outreach and community engagement can improve health literacy in simple ways, and all it takes is simple acts. And I'll show you, this is an example of a webinar that I did, and I'm not doing this to highlight myself in any way, but just to show you that I believe exactly what I'm telling you. And so with this webinar, there were over 100 men there, and I gave a simple talk on prostate cancer. It didn't cost me any money, just a little bit of my time. And then speaking with several of those gentlemen afterwards, they felt as though now they had a working knowledge of the disease of prostate cancer. And so this allows patients to now advocate for themselves and have a better understanding of everything that is going on as it relates to healthcare. And they show you proof of this and data of why health literacy is so important. Let's look at when low health literacy is and its impact on health outcomes. So this systemic review looked at over 100 papers, and they concluded that low health literacy was consistently associated with more hospitalizations, greater use of emergency care, lower receipt of mammography screening and influenza vaccine, poor ability to demonstrate taking medications appropriately. And I know that's a wordy way to say low health literacy is associated with poor outcomes and a poor use of healthcare services. So again, getting out into the community and doing community outreach and community engagement is a way to improve health literacy. Additionally, it's been shown in study after study after study that community engagement can increase participation in clinical trials, as well as improve physician mistrust, which is so important nowadays, especially within the COVID-19 pandemic. And there's a huge mistrust within the Black and minority communities when it comes to getting vaccinated. And that's based off of the history. But one way to kind of combat that is to go out and do community outreach and community engagement. And lastly, I'm gonna touch on increasing diversity in medicine really quickly. So, there is well known that there is a lack of diversity in medicine. Otherwise, we wouldn't have a conference like the one that we have today. And why is this so important? Well, study after study have shown minority patients taken care of by minority physicians get better quality healthcare. And so, obviously there is a need to improve diversity in medicine. And if you want an example of that, I'm gonna just highlight Doctors of Tomorrow here at University of Michigan really quickly. When I first got here to University of Michigan, I remember sitting down with Ganesh, the chair of my department, and telling them how passionate I was about community engagement, community outreach, and doing this work. And he emailed several people. Ironically, Jonathan was probably like the only person who actually responded. But we were able to, and I'm talking about Jonathan Finks, and we were able to sit down and talk. And he said that he told me, I'm not from a disadvantaged background, but I saw a need and I wanted to impact change. And so now this program is something that many people from across the nation are trying to find a way to implement. And so this kind of highlights the fact that, you don't have to have $1 million startup to actually go out and start to impact change and enact change. And so lastly, I'm gonna talk on mentorship as we kind of round out these three things that I wanted to highlight. And so, when I sat down to make this slide deck, I thought about all the different ways that I could highlight the data showing the importance of mentorship. But one of my mentors, who I highlight here shortly in my talk, told me, Randy, whenever you get the opportunity to give a talk, share your story. There's power in it. And so when I thought about how could I really emphasize the fact that I think mentorship is so important, I went to the NIH website and I looked up factors that they classify you as being from a disadvantaged background. And so free or reduced lunch growing up, I checked that box. Had no parents who graduated or received a bachelor's, I checked that box. Now I will say this, I want to give credit to my mom who had me at the age of 19. She did go back to college, and she graduated college when I was in college, and I'm extremely proud of her hard work. But moving on, eligible for Pell Grants, I checked that box. Parents receive WIC, check. Grew up in a low income area, check. But let's take that a step further. And, I want to share with you all things that I've personally seen and been through in life, so that way I can kind of reinforce why I feel like mentorship is so important. And so I had multiple family members and friends who have been incarcerated for over a decade. I attended low performing schools. I lived in areas that were food deserts. I had multiple friends and family members who have either been shot or killed. I know what it's like to lose a parent suddenly at an early age, and I was exposed to drug deals and drug use well before I graduated elementary school. It was something that, at the time, me and my friends would joke about as we got older, that we knew how to spot a hand-to-hand drug deal before we even knew our multiplication tables. Additionally, I vividly remember walking home from elementary school and seeing addicts shoot up. And because they had blew the veins in their arms and their necks, they, started to use the external genitalia to inject heroin. So, I'm not saying this for pity from any of you. I'm saying this because this is not a game. People are literally struggling and dying every single day as a result of these oppressive systems. And we can no longer sit on the sideline and talk about these things in our little bubbles. We got to get out there and we have to impact change. And so I'm going to highlight one of my mentors, Mrs. Shirley Roberson. She said this to me. She said, sometimes your mentors can see things in you that you can't see in yourself. And why is this important? Well, this quote, talent is equally distributed, but opportunities are not, shows exactly why it's important. It's extremely difficult to become something that you have never seen. Additionally, it's extremely difficult to walk a path that you don't even know exists. So again, we cannot sit in our little bubbles and talk about these things and not get out in the community and actually interact with these young people and provide mentorship and exposure. So in conclusion, I'm gonna say this: physicians have a certain amount of social status, and we have to use that to impact change. Simple steps: unlearning inaccurate information, learning and combating the history of racism and the resulting narratives that we touched on. Become involved in community outreach and increase mentorship to the next generation. So I want to give a quick thanks to my parents. My father, this is a picture of me and my father here on the left. I lost him at the age of 12, but every day I navigate this world. I hope I'm a man that he could be proud of. And then my mom on the right, who is by far the most hardworking and generous person I know. It's been a long road to get to this point, to be able to, give these keynote talks from where I grew up. And for my family, I want you to know that I always put on for y'all, and I'll take you every step of the way. And so I want to give you this final thought. Gandhi, who was perhaps the biggest warrior for social justice in the history of mankind, he said, "Be the change you wish to see in the world." So I challenge everyone attending this conference today to not only talk about enacting change, but to actually be the change we wish to see. And with that, I want to again thank you all for the opportunity. That concludes my talk, and I'll be happy to take any questions.
Thank you, Dr. Vince. That was an amazing talk and very emotional. Thank you for that. Everyone, I encourage you to put your questions in the Q&A and we can ask them to Dr. Vince. We have a little bit of time. I'll start with one question. Dr. Vince, as an early learner myself and many early learners alike, we're encouraged and we feel the pull and need to give mentorship back to the communities that we serve and are surrounded by. And you highlighted Doctors of Tomorrow here, which many members of the leadership group are a part of. What recommendations do you have for the M1s through M4s as we begin that journey of mentoring a high school student coming from a background that may not be similar to our own?
Mm-hmm. Well, I think it just starts with being open and honest, right? Like, someone from, so I come from a disadvantaged background, right? But I'm not going to say to someone who's trying to provide mentorship to me that, oh, you don't come from the same neighborhood I come from, so I don't want your mentorship, right? But being open and honest about yourself and allowing that person to get to know you will establish a trust. And then from that point on, everything else you do, they'll know is genuine. And they're more likely to receive it. So that would be the first step.
That's great advice. A question I was curious about, how have you bridged your work with genomics into combating systemic racism?
Yeah, so there's been studies done. I do a lot of. I'm in a urologic oncology fellow, so we focus on urologic cancers, um, and there's been studies done in other fields that show the impact of poverty, the impact of daily racial discrimination on epigenetics, which is not someone's actual genetic code that they're born with, but it influences how that code is now transcribed, right? And so I feel as though we need to do a better job with that within the cancer biology space because, I gave an example in a recent interview that I did with the health lab. One of the things that is commonly accepted is the fact that cigarette smoke can increase your risk of cancer, right? That's an environmental exposure because of the impact that it has on your epigenome. And so, why is it that we think that there are no other environmental exposures or lifestyle choices that can actually influence the epigenome? And so, that's really where my research is. I'm trying to take it down that path so that way we can really highlight how these inequities have a cost on our on our health outcomes.
Awesome. Thank you for explaining that. Curious on your thoughts about recruitment versus retention. Is one more important than the other, or do we really need both?
I mean, yeah, I think there needs to be both. Because it's hard to recruit somebody to come to your institution if you're not retaining any minority faculty, right? So I think it has to be a combination of both. But that comes with fostering an environment that allows minority faculty members to feel like themselves and to flourish. We could do a better job of that within medicine. I think I see. I don't know if people are posting it in the chat or what.
Yep.
Like I see like little questions popping up.
There was a question put in the chat and the Q&A, so I'll take from the Q&A first. From the Q&A, I really appreciate your uneducation/relearning approach, but you briefly mentioned increasing diverse patient populations in research studies. Have you had any opportunities to have those conversations within the community?
So when I do these webinars, I do talk about the lack of diversity in clinical trials, but I'm just one person, so I can't impact the change that needs to be that needs to actually happen on a large scale. And again, there has to be collective buy-in in order to do this. So so yes, I have acknowledged it as I do community outreach, but again, I'm one person, so I can't speak for everyone at Michigan Medicine. So it needs to be a collective buy-in at the institution level.
Couldn't agree more. There's another question on your thoughts on intentional recruitment. I'm guessing that's in relation to recruiting a diverse group of faculty members.
Well, I mean, we just kind of touched on that, like, intentional recruitment and retention is imperative. Again, but it has to be intentional and it has to be at the institutional level. There's many times a lack of institutional buy-in, right? And so these these places with privilege and a huge platform oftentimes lack a buy-in, right? And so, I mean, I think that was kind of highlighted in that JAMA podcast that recently came out, right? Because people were, who it's hard for me to expect someone who benefits from a repressive system to want to make changes about it if they don't even know that it exists, right? Because they're just reaping all the benefits. And that's, if that podcast highlighted anything, that's what it highlighted to me.
Definitely agree. Another question in the chat. Traditionally, mentorship and outreach haven't been rewarded the same way as other academic medicine pursuits and achievements. Do you think that this is changing, and what can we do to ensure that this work is being recognized appropriately?
Yeah, at the fair, sounding like a broken record. There has to be buy-in at the institutional level, right? Like, so this work of doing community outreach, of mentorship, we people who engage in it, we have the same 24 hours as everyone else, right? But this is extremely important. So it should be rewarded and compensated as such, but it's not right now. And so again, at the it sounded like a broken record. There has to be institutional buy-in.
Understood. What advice do you have for junior faculty to advocate for changing an unjust systemized policy within executive department members who talk about DEI, but those that may not be in attendance today?
Yeah, well, I mean, like I said, I'm a fellow, so while I'm considered faculty at Michigan Medicine, like I'm not even in the assistant professorship position right now. So, but in my experience, you share exactly why it's important to you, and sometimes people aren't going to get it, and it's going to be extremely frustrating. But that doesn't mean you stop. I I always like I'm a big hip hop fan, and so I always quote like Nipsey Hussle when he says the marathon continues. Like, so when you get that pushback, you keep going because the marathon continues, because what we're after and what we're chasing, that is so much larger than that interpersonal interaction you had.
Definitely. Another question, how can medical ethics committees incorporate an anti-racist agenda? And this is being asked from a pre-medical student.
Yeah. That's a good question. And I'm not sure that I exactly have like a systematic answer to it. But again, I think everything starts around educating yourself about, the actual history of our country and how structural racism has been implemented. And then you can build off of that. Knowledge and education has to be the foundation. And then you can build off of that.
Great. We'll make this the final question. It's actually from Dr. Finks in the chat. On the topic of retention, we struggle to retain underrepresented students who matriculate to the University of Michigan. They often leave and drop off of STEP pathways for many reasons. What are some ways that you think we can act to ensure their success after we recruit them to come here?
Yeah. Well, I think, to be honest, you have to find out what the experience of those minority students are when they get to University of Michigan. If I come to a place and I feel as though I'm out of place, it's not welcoming, and it's a semi-hostile environment that is not allowing me to, really reach my potential, why would I want to stay? Right. So, the best people to ask on how you can improve things are the people who are not sticking around, right? Because at that point, they no longer have an obligation to try to sugarcoat things for you. That tell you the truth. I left because X, Y, and Z. And it's up to you to listen to it and actually make changes, or, you can try to allow things to keep going and stay with the status quo.
Awesome. Well, thank you, Dr. Vince. Thank you for your time today and for talking with us
thank you,
and
guys.
answering questions. Everybody, I want to put a plug in for the poster session that's happening right now. The posters from the bottom in the session were moved to the top. So things were moved around a little bit. So go ahead and take a look at that. And we will be back at 1:35 for the Changemaker conversation. Okay. Thank you again, Dr. Vince.
Yeah, it was my pleasure.